Fascinating the way different people become extremely successful. My next guest started his business in a favela of Sao Paulo. It's now one of the biggest healthcare providers in South America. It's Dr. Consulta. Now, how did Dr. Consulta become so big and, more importantly, so significant in the healthcare business? Well, private healthcare is usually connected to insurance companies. That's the normal way, say, for example, in the United States. You pay network plans and premiums. Well, Dr. Consulta has a completely different way, and this is why you go up. Dr. Consulta uses cloud technology. It creates a digital record of every patient, amassing troves of clinical data. It then uses algorithms to diagnose patients and link them with the best treatment. It creates a more efficient and a cheaper system. Dr. Consulta, which is now fascinating, is quite simply cutting out the insurance companies. It matches the patients with the doctors and only charges people for the care they need and use. Thomaz Srougi is the founder and CEO. This is fascinating. Now, look, it's clearly working, but who pays the bill?
Patients pay the bill.
The patients pay the bill. And the role of the insurance company is not eliminated in that sense because the patients don't pay the full bill, surely. I mean, if it's a major operation or it's a major treatment, then there's going to be more pay than they will pay on the copay.
So first of all, let me tell you what we do. We combine technology, data, and the best doctors to offer the best quality for all. And by for all, I mean uninsured and insured patients. So they pay out of pocket. It's cash or credit. We believe that people need to have the freedom of option to pay for healthcare whenever they need it, wherever they want it.
So how do you save?
How do we save costs?
Save the costs? Where does, you know, because this is the holy grail of most economies at the moment. And wherever I look, every government is grappling with it.
Yeah, so it's a global problem, right? Not only in Brazil, but in Brazil, we needed to cut costs because there's no other option. People can't afford healthcare. Healthcare is very expensive. They can't afford it. 75% of the population can't pay for private health insurance. So we needed to be extremely effective to be able to offer what we wanted. So we've deployed lots of technology along the process. We've disintermediated the broker or the health insurance to have a direct-to-consumer relationship. And we've decided to focus on a very specific piece of the value chain, the healthcare value chain, so that we could use our assets way more effectively.
I'm always suspicious when somebody says that they've found a solution to the healthcare problem. It is the third rail of politics. Now, Brazil's in a particularly bad economic shape at the moment, so I guess anything is of help.
Well, I don't think we don't claim to have found the solution. We're way more efficient. We lowered costs. We're very efficient. And we're very fast. People in Brazil, they need access. So we've been able to combine retail concept with healthcare and technology so that we're close to everyone.
And are you finding interest elsewhere in the world from this? Because it's very difficult to change established and entrenched healthcare systems. You know, you start. It's like snagging a sweater on a nail. The thing will fall apart.
Well. And that's what we've done in Brazil. We've been able to recreate or reboot a healthcare model within a very well-established healthcare system. So we had to completely ignore health insurance players. We had to ignore the government to be able to set our own system. We're self-sufficient. We have a proprietary flow of patients and doctors, the best doctors in the country. And we leverage everything from there. So it's possible.
Good to see you, sir. Thank you very much indeed. Now,